Low T99 presents What's in the Box, an overview of your first shipment. For more information, visit lowt99.com. We've presented this video in a way that you can pause at any time to take a closer look and compare what you've received versus what you see in the video. So your shipment has arrived, and it should look pretty similar to this box. It was shipped via US mail. Once you open the box and unpack it, maybe on your dining room table, you see there are a lot of elements, and it's important to remember that each piece serves a purpose. And if you're confused, take a look at this video as many times as you need to, or give our office a call. We're happy to help you. So you can see you have a lot of syringes and needles, a bottle of pills, perhaps a couple bottles of pills, a bottle of HCG if you've been prescribed that, your testosterone, alcohol wipes, and some paper instructions, as well as a packing list. And as each prescription varies and is personalized to the patient, this may or may not look exactly like what you received in the mail, but I'm hoping to make it look as close as possible. So I'll go ahead and separate each component into its group of items. And the first one are your supplies for testosterone injections. And you'll see that I've separated out the needles that are on their own. They're the 25 gauge needles, blue in the upper left-hand corner. And then on the upper right portion of the picture are the 3 ml syringes with the 18 gauge needles attached. The lower right hand, you have your alcohol wipes. And then the lower left hand, you have a small box containing the 5 milliliter vial of testosterone. And here you'll see the 3 ml syringes with 18 gauge needles attached. We include 5 of them in your shipments. And these are used for drawing up testosterone. We always use a larger needle to draw up and a smaller needle to inject. And the thing to know about needle sizes is a larger gauge, a higher number gauge, actually means it's a smaller needle. Sort of a tricky thing to remember there. But these are 18 gauge needles, which are quite large, and they make it easy to draw up the testosterone, which is in an oil, so it can take a little force to draw it up. Now we focus on the needles used for injection. They are 25 gauge, so smaller for the intramuscular injection, and they're just found on their own in their own baggie. And here we find the alcohol swabs. You'll use the alcohol wipes to wipe the top of a vial before you remove any medication from a vial, and you also use it to clean your skin before any injection. And next we take a look at the testosterone itself. So we include a 5 ml vial of testosterone, and of course, as your prescription may vary from what you see here, it might be a little bit different for you. And we see the bottle. It's clear, you can see the oil contained inside, and then we have a look at the cap that is just a little piece of metal that you will flip off, and that's where you will actually access the testosterone. Here you see all the supplies needed for your HCG solution mixing and injection. And if you take a look at our YouTube playlist, we go into this in more detail in a video specifically about mixing up and injecting HCG. But here we have the HCG powder and water to make the solution, the mixing syringe, which is a 6 ml syringe. It's the largest size syringe you'll find in your package, and also the 1 ml or insulin size syringes you use to actually make that subcutaneous injection of HCG that usually goes in the belly. And last but not least are any oral medications you may have been prescribed by your physician. Commonly, it includes anastrozole that will be prescribed with testosterone, and also any erectile dysfunction medications, and you will just go ahead and take those as prescribed by your physician.